We have two special guests in the house now, Dr. Amber Gordon and Dr. Cassie Burns with Infirmary Health, to talk about the importance of having a healthy back and a specialized program at Infirmary Health. We were talking about spinal treatments. First off, ladies, thank you for stopping by, because I know this is a busy time for you both.
Yes, thank you so much for having us.
And the treatment, you said there are some red flags. Can you talk about that? Like, how long should a person wait?
Right, so back pain is very prevalent. At least 80% of our population will experience back pain at some point in their life. But there are some red flags to look for, and if you're experiencing these, you should really seek treatment immediately. And those are things like weakness, numbness and tingling that aren't going away, or loss of control of your bowel and bladder. And if you're experiencing those things, you really should seek treatment immediately. Go see your primary care physician or even go to the emergency room.
And I do want to kind of back up here, because I know that you guys have this Neuroscience Center of Excellence. Can you talk about the significance of that?
Right, so the Neuroscience Center of Excellence is both an idea as well as a physical space. The Center of Excellence is a multidisciplinary group of physicians, just like myself and Dr. Burns, and we really look at each individual patient and come up with a treatment plan that is special just for them to get them through their pain and hopefully get them well without surgery.
Okay, and Dr. Burns, can you talk a little bit about pain management? I know that you are on the side of, you know, helping people with those injections, but elaborate on that, please.
Yes, so pain management years ago had not as great a reputation, but now we have so many modalities that we can offer patients. Injections are one of the things. We also get them in physical therapy. We do use anti-inflammatories. It's not as scary as it used to be. So,
but the bottom line is, you know, if you can help it, don't put it off.
Correct.
Absolutely. I think the bottom line would be it's not as scary as it used to be, and there's some great treatment options that are out there now that are less invasive and sometimes non-surgical that really help and get you free of pain.
Okay. And I know we've been talking a lot about back pain specifically, but what about spinal pain and injuries, and like what are the difference between those two procedures?
Yeah, there's all, you know, the back consists of different areas. You have your neck, your middle back, your lower back, and then your sacral area. So, and we can do all kinds of injections for each of those. She does surgeries for those areas. So it just depends on which area you're having the pain in. That's the area we treat.
Well, ladies, thank you so much for stopping by. A lot of good information there.